District City Councilor. Today is Thursday, May 17th. We are here again with our friends from the Boston Public Health Commission. And today's topics of this afternoon's topics of discussion are, where are we? Child and family health, infectious disease, and community initiatives as they pertain to dockets 0559 through 0563. Orders for the fiscal year 19 operating budget, including annual appropriations for departmental operations, annual appropriations for the school department, and appropriations for other post-employment benefits, appropriations for certain transportation and public realm improvements, and appropriation for certain park improvements, as well as dockets 0564 and 0565. Capital budget appropriations, including loan orders and lease and purchase agreements. I'd like to remind folks in the chamber that this is a public hearing, both being broadcast live and recorded on RCN 82, Comcast Channel 8, and Verizon 1964, and streamed on boston.gov/city-council-TV. I'd ask you all in the chamber to silence any electronic devices. At the conclusion of the departmental presentation and questions from my colleagues, we will take public testimony. There is a sign-in sheet off to my left. We ask that you state your name, affiliation, residence, and please check the box yes if you do wish to testify publicly. I'd like to introduce my colleagues in order of their arrival. To my far left, Councilor Ed Flynn, Councilor Tim McCarthy, Councilor Josh Zakem, and Councilor Michelle Wu have also joined us. With that, Monica, I'd like to just hand it over to you for your presentation.
Great. Thank you, Chairman Sioma, and all the councilors for hosting us for part 2 of our hearing with you this afternoon. Again, my name is Monica Valdez-Lupi, and I'm the Executive Director of the Boston Public Health Commission. I'm joined this afternoon by Grace Connolly, who is our Director of Administration and Finance. Thank you for the opportunity to highlight all the important work that's being done at the Commission, and in particular, these 3 bureaus this afternoon. We're proud of the budget that's being proposed and before you today. We've been working diligently around our spending and managing our resources in accordance with mayoral and organizational priorities. One of the things that's not directly related to our budget process, but which has been one of our key accomplishments this year is the fact that we've received public health accreditation from the Public Health Accreditation Board. On this slide, this is our organizational chart, and again, we'll review the work that's being led by our Child, Adolescent, Family Health Bureau, Community Initiatives, and Infectious Disease Bureau. What I would like to leave all of you with in terms of a key takeaway following our presentation and discussion this afternoon is that these 3 bureaus in particular and overall the Commission, but these 3 in particular, work very hard to build healthy communities. And the things that we'll highlight will just be a snapshot of the different ways that our bureaus work together with our partners to impact the community around us through engagement, youth development, and safe and resilient communities. In this slide, we have some highlights from our Child, Adolescent, and Family Health Bureau, or our CAF Bureau, which works to address the physical and mental health needs of our children, youth, and families, especially those whose health is compromised by social inequity. By collaborating with different programs at the Commission and with external partners, we provide public health education, training, and professional development for youth workers and young people in an effort to increase their competencies and skills. We work really hard to ensure that our youth-related programs reflect a youth development model, incorporating both youth development principles and public health standards of practice. Our programs all operate on a principle that our youth and our students are leaders in our community. They help drive action in these programs and throughout the Commission, and because of their leadership, serve as ideal messengers of the public health information that we're trying to push out among their classmates and their peers. In this slide, you can see some of our youth at a Child and Adolescent Health Division event where they hosted their first and extremely successful Boston Youth Health Fair. The Youth Development Network completed its 4th year of summer youth employment programs for high school students that require summer term classes. And through the network, we've been able to hire 18 youth who completed their summer coursework and life skills training. These students have all engaged more successfully in this academic year because of their involvement in this program. The network also continues to address chronic absenteeism in 4 of our high schools, the Jeremiah Burke, Madison Park, Brighton High Schools, and Charlestown High, through case management and mentoring throughout the year. In this slide, we have some highlights of the work, from the work that our neighborhood trauma teams are doing throughout the city. And I know several of you have met with or familiar with this network of providers. Through this initiative, we're able to offer critical services for individuals, families, and communities that have been impacted by violence. We work with community health centers and community-based organizations and have a mobile team through JRI's SMART team, where we're able to provide crisis response services to any individuals that have been impacted by community violence, connections to community support, support for individuals and families during community events that include vigils, memorials, and funeral services, and most importantly, or as important, referral to ongoing behavioral health services for individuals and families who need ongoing support and recovery services for the trauma that they've experienced. Thanks to the investments included in Mayor Walsh's budget, we'll be able to expand the neighborhood trauma teams network from 5 to 6 neighborhood teams, with 1 additional team in Dorchester pending final approval of our FY19 funding. Other goals for FY19 for the program include implementing a trauma response and recovery learning community, offering more evidence-based treatment training, and then increasing the capacity to demonstrate the effectiveness of the program by creating a stronger data collection and analysis of the work that our teams do. Through this bureau, the CAF Bureau, we also operate school-based health centers. Through the health centers, we're able to deliver health education and health care to students in 8 public schools. Some of the services include primary medical care as well as mental health and reproductive health education and care. They're able to, with the team of staff there, provide accessible, culturally and linguistically competent and developmentally appropriate healthcare services for youth in their schools. In FY18, the centers implemented several initiatives to improve billing and operations to more effectively deliver mental health services. 6 out of 8 of our mental health clinicians have completed credentialing with BMC, and clinicians have been trained on how to use the hospital's electronic medical record system and billing systems. Mental health billing for services started on a pilot basis in 1 school-based health center in April to assess some logistical and workflow issues, and the current plan is to expand that to 3 more sites by next month. In FY19, there is an investment from Mayor Walsh to support efforts at the Commission in developing a marijuana communications campaign, particularly after and as the laws around recreational marijuana are rolled out. And we know that by talking with other colleagues in other cities and states that young people are vulnerable as access is opened up. And so we'll be working with other partners and other departments to ensure that the information that we develop is comprehensive in meeting the needs of our young adults. Shifting to Community Initiatives Bureau, in this particular area of the Commission, they work to address health issues affecting Boston through community and home-based services. The Bureau supports our commitment to community engagement, environmental health concerns, chronic disease prevention and management, access to health care, and enforcement of citywide health regulations. Programs like the Mayor's Healthline, tobacco control, and chronic disease prevention work hard to deliver direct services to residents. And we're really excited that we'll be working with Commissioner Cook in our Parks and Rec Department again this year to launch the Summer Fitness Series. And that kickoff event is on May 31st in Copley Square, so we hope you'll all join us. In this slide, it looks a little busy, but wanted to show you some numbers in terms of the Bureau in action. You can see that we have environmental health inspectors who are out in the field responding to environmental health hazards, inspecting businesses, issuing permits, and doing a lot of training and technical assistance to the communities, the business communities that we regulate. There's also information about our Safe Shops program, and so this is just another way of looking at the work that they do in the community. For FY19, some of the activities that we wanted to highlight include that we'll be working to develop a prostate health campaign, also working on strengthening the work that we do through our Office of Food Initiatives on the Farm Fresh Boston campaign. We're also going to be rolling out a new online app and payment process for the permits that we issue through this Bureau in FY19. And rounding out the group are some highlights from our Infectious Disease Bureau. So this particular bureau works with diverse communities in Boston to reduce the impact of infectious diseases, prevent morbidity or sickness associated with those diseases, and create healthier lives for our residents. As you can see from this slide, our staff works really hard to ensure that Boston residents have linguistically and culturally competent information that they need to know what they can do to protect themselves from different communicable diseases. Additionally, the Bureau provides funding and technical assistance grants to community-based providers in the city who deliver community-based prevention and education, mostly aimed at raising community awareness around how to prevent and lower infection rates. Funding is also targeted around culturally and linguistically competent service providers. Here are some highlights from some of our work in FY18 in this Bureau. Our Communicable Disease Control Division investigated over 9,000 reports of communicable diseases in the city. They responded to over 100 exposures, clusters, and outbreaks. And the division also developed an electronic data analytic and visualization platform to provide near real-time information. In FY19, the Bureau plans on continuing to work to reduce chlamydia rates among Boston residents between the ages of 15 and 24, and to also reduce the gap in chlamydia rates between Black, Latino, and white residents between that same age group by 25%. They'll also be working with our colleagues from the Recovery Services Bureau to reduce hepatitis C and HIV rates among people who inject drugs by increasing awareness of safer injection practices and encouraging more testing. They'll also be collaborating with our AHOPE, or Harm Reduction and Needle Exchange program, to assist individuals who inject drugs with linkage to care for treatment. They also plan on completely rolling out their data visualization platform in FY19. So in closing, I want to thank Mayor Walsh, our colleagues at the Office of Budget Management team for their support and service. I want to also thank our board members, the Board of Health, for their continuing guidance and leadership during this budget process. We've worked closely with our board members in terms of preparing our budget submission, and want to thank all of you for your support throughout the year. At this point, I'm going to turn it over to our A&F Director, Grace Connolly.
Thank you, Monica. Just very quickly, a brief overview of these three bureaus. Combined, they're approximately $21.5 million for next year, which is about a quarter of the public health appropriation, 168 FTEs, and that's about 18%. There are no capital projects specifically dedicated to these bureaus, but they will benefit from the $1.5 million that is proposed for IT infrastructure. That will help everyone. And I think we went through the numbers earlier today, so I want to go over them again with you.
Okay,
unless you'd like
great.
to.
Yeah, it's the same packet of budget information associated. I'm going to recognize Councilor Ed Flynn for first line of questions.
Thank you, Councilor, and thank you for being with us today. I noticed in one of your charts there was about 40 cases of tuberculosis in the city. I know years ago that used to be a common disease with a lot of Irish immigrants. My grandfather had tuberculosis. But why and how are people getting tuberculosis today, and what is being done to help them?
So thanks for your question. We actually work with Boston Medical Center, where we operate our TB clinic. And what we see in the city of Boston is actually very different than what other cities see. So in terms of active cases, we actually have fewer active cases. In FY18, we have 42 confirmed cases. What we do see in the clinic are more cases of what they call sleeping TB. As you've already appropriately pointed out, given your grandparent with experiencing TB, many of the patients that we see coming into our TB clinic at BMC are first-generation immigrants and have probably contracted TB overseas and then move here to Boston. So it is a disease that is predominantly among immigrants in that clinic.
Thank you. And I was just reading some of the charts. In my community in South Boston, we have a high number of cases of asthma, scleroderma. And I think a lot of it has to do with the environment as well. Are you seeing that throughout the city, scleroderma and asthma increasing?
I know in terms of, I would have to get back to you on the second condition, scleroderma. And then in terms of asthma, it is, we actually have seen decreases. So this is one of those, when I was thinking about progress since the last time we visited you all for the budget hearing, that we actually have seen progress in terms of a decrease in the rates of our asthma ED visits in the city between this time period. We have also seen a decrease in asthma hospitalization rate among Latino children, but certainly when you look at in the charts that you pointed out, Counselor, there are disparities in certain neighborhoods, and asthma continues to be one of those issues that we see in some of the some of the neighborhoods where very diverse neighborhoods. So, and oftentimes there are triggers in the home, and we have environmental health staff and home visitors that do home visits that try to help our clients and connect them to programs like the Breathe Easy at Home program at BMC.
And I guess my final question for this round is I just want to thank you for agreeing to work with me on developing or pursuing a comprehensive public health study for the residents of Chinatown. And that's something that's important to the community. And I know it's important to my fellow councilors as well. So we just want to thank you for your commitment on that as well.
And I appreciate your commitment and your elevating issues for Asian Americans, particularly as an Asian American, Filipina American myself. I'm really impressed that you've taken this cause as one of your priorities. And yes, we look forward to working with you. And I had already reached out to our colleagues, Sherry Dong at Tufts. And she directs the community benefits community programs, and happy to work with you to look at what an assessment might look like for the health of Chinatown residents.
Thank you.
Thank you, Councilor Flynn. We've since been joined by Councilor Nisa Sabi George. Councilor McCarthy.
Thank you very much, Mr. Chair, and welcome back. Good afternoon. It was good morning a couple hours ago. First, I always like to say thanks to Berto Sanchez around this point in time, who comes around and does his Narcan thing. He's been outstanding. We've had him at a couple of the libraries and some of the places in District 5, and he's been outstanding. So I always like to give him a shout out. So the marijuana communications campaign, I'm very interested in this. As you know, a bunch of us went out to Denver. They didn't get ahead of it, clearly. There was an article, I want to say it was in the Washington Gazette. I do have it. Basically, it's the 50th anniversary of the Denver social experiment, I like to call it, and how it hasn't been a good experiment for Denver. Dropouts higher, pregnancies higher, birth rates, defects higher, accidents due to marijuana consumption while driving is higher. So there's a lot of points that make me very concerned. That's why I was no on that question from the get-go. But that horse is out of the barn, as we know. So I think it's really important, as we're starting to see already on Clear Channel billboards, you know, whether it's Read Maps or there's a bunch of them. I'm not going to give them any public airtime, but already advertisements, you know, misleading statistics regarding what pot does to a society has already started to pop up. So how much money are we spending on the marijuana communications campaign? When does it launch? And how can we as a council make this rollout as big as we can possibly make it? Because I think it's that important.
So thank you for that question, and I know that we were anticipating that we would be in this place at about this time after the ballot initiative and the law was passed. We held a virtual meeting with our colleagues at the State Health Department in Colorado, and they did give us some good advice. This was last spring, I think, when we invited them to present before our board as we were anticipating what our role might be. And clearly, I would say that there are two key roles that we play in this space. Prevention and the messaging around it is one of them. The second is around surveillance and data. And so our colleagues in Colorado, one of their main tips to us was make sure that you have good baseline data. So I can share with you that in our Health of Boston report, through a survey that we do called the Behavioral Risk Factor Surveillance Survey, and then in partnership with Boston Public Schools, they run a similar survey for youth, the YRBS. We've got good baseline data already on sort of recreational implementation in terms of use. The amount that has been proposed in FY19 is $75,000 to develop that campaign. And I wanted to also highlight that in FY19, there was also funding to support two FTEs that were focused on prevention. I believe one was related to the work that Jen Tracy in our mayor's office for recovery services is leading related to her prevention report that will be released. And then the second position, prevention, will sit within our Bureau of Recovery Services. But obviously, you know, across the Bureau and across the organization, it's all hands on deck in terms of the campaign. In terms of the role or support, we would love to work with the City Council in getting your feedback from your constituents. We haven't really planned it out yet. Right. We've been having discussions internally, just looking at how other cities and states have designed the different materials, but I imagine we'll begin planning it, thinking about focus groups, community meetings, and would really welcome the opportunity to partner with all of you on how to craft the message and then launch the campaign.
Yeah, there's some great partners in this building. I see Chief Martinez up there, and Boston Centers for Youth and Families, clearly all the community-based organizations that we work with during the summertime. There's 162 CBOs I think we're working with this summertime. You also have the faith-based organizations. I think this is one of those issues that it really needs to be an all hands on deck, where Boston Public Schools get involved, as well as parochial and private schools. It's important, and I think that some of the clear channels of the world, this is where they need to step up and help us out with the PSAs and things like that. So I know that my office will certainly be
great.
With two boys myself, I think that teenagers need another option for a vice, like they need a hole in the head, and this is another option. So we need to get ahead of it. But I appreciate all the efforts, and again, when you start cranking this up, I'd love to be a part of it. Excellent. Thank you, Mr. Chair.
Thank you. Councilor Sabi George.
Oh, thank you. I didn't think I was so soon. Well, thank you again for being here for round two. Just to follow up to Councilor McCarthy's questions on the marijuana use and the work with BPS. As far as I was aware, the risk data that they were collecting wasn't separating marijuana use out specifically.
There are actually some questions around marijuana, and if you'd like, I can refer to some of those questions if
Yeah, that would
you'd
be
like.
great.
So in their survey, they actually have a question for the high school students around marijuana use in the past 30 days. And so we have data that show that in the past 30 days that the rate has increased overall from 2003 to 2017. And the increase was driven by an increase in Latino students who reported using marijuana in the past 30 days. When we looked at other ethnic breakouts, there wasn't a significant change when you looked at Asian, Black, or white students. And this is dated, right? But just to give you a sense.
Yeah, I know the baseline's so
Yeah.
important to know it.
Yeah, let's see, for both 2003 to 2009 and then 2011 to 2017, the percentage of Asian students reporting using marijuana in the past 30 days was lower compared to white students. Black students and white students had similar percentages for that same period of time. But this is certainly information that we can work with Assistant Superintendent Amalio Nieves and Jill Clark and packaging for you so
Great.
that you have that.
And then also the perception of risk. So it's marijuana use, but then also measuring what they think is or perceive the risk to be of marijuana use. And I know when we went to Denver, I met with, I think probably their equivalent to Amalio Nieves, his counterpart in Denver, a similar counterpart. One of their concerns was not having the perception of risk data as well. And they were seeing over a short period of time a drop in the perception of risk, which is not a good thing.
And I think that is actually a reminder of some of that they raised that, because you've got medical and now recreational, throughout the country, that it becomes normalized
Right.
in terms of perception. So I'd have to go back and double check on whether we have
Great.
specific questions.
Thank you. And then regarding marijuana, I think anecdotally, I see that there's a increase in public consumption. Are we involved at all in some awareness, as opposed to ticket writing or something like that, but just some general awareness about public use?
I don't specifically, that doesn't specifically fall under the commission, but we can certainly find out. I believe I would defer to Commissioner Evans in terms of enforcement, but we can double check in terms of.
Right, and I don't know whether that can be incorporated at all into your campaign.
In terms of the public use, in terms of the way we would get involved, would be around enforcing our smoke-free workplace rules. So certainly that's where we would be involved in tailoring the messages.
Great, thank you. And then I have some questions about the school-based health centers. What is your relationship with, the commission's relationship with the health centers that do operate in our schools?
So there is a network of school-based health centers, and we work really closely. I'm trying to find the tab because we're not in all of the high schools. As I said, on the slide, we listed out which ones we were in. We actually do work really closely with the school-operated health centers on wellness policies. We often work collaboratively with them around ensuring that we're on this, that we're aligned in terms of the resources and materials that we're developing. But we do work closely with BPS.
Is there a way to have a greater presence, especially thinking about mental health services in our schools through the commission? Because we often have in many of our schools, many of the mental health and behavioral health specialists that work in our schools are often working with a fee-for-service model, so they're not necessarily able to see every student. I don't know whether or not the commission can get more involved in some of that work in particular.
And I seem to think that we have provided some additional capacity when needed if there's been a particular incident or event at the school, because you're right. I mean, even in our own school-based health centers, I believe the top two primary reasons for the visits are related to behavioral health and then family planning. So I can check back with staff to confirm what types of formal processes we have in place around connecting our behavioral health. We have several social workers who work across the school-based health centers, so I can double check on that for you as well.
And then, thank you, I appreciate that. And I think it's a real opportunity to make sure that our kids are getting support services prior to an incident as well. So as much as we can be very redundant when it comes to mental and behavioral health. I think that's a good thing. You also have a program called Project Launch, which works specifically to early childhood mental health. And it looks like there's been maybe an increase with your work, and it looks like it's in partnership with the BPS. I don't know if you're familiar at all with it. We got a request.
I am familiar with Project Launch and the work that they do around early childhood development. That is within our Child, Adolescent, Family Health Bureau. I don't have any specific information, though, about those updated activities, but was there a specific part of the
I'm
initiative?
just trying to
that you just-
understand the full impact that it could have with the investment that we make, both internally and externally, and then also understanding the partnership between BPS, how many kids we're accessing. But if that question's probably more appropriate for BPS?
I can follow up and double check, but I know that we've been working with, so one way that we work with that 0 to 3, 0 to 5 population is that BPS and BPHC were involved in advisory capacities to Children's Hospital Boston as they were developing their determination of need funding. So if you recall, under the state DOM process, Children's Hospital had about $53 million in community health initiatives that they were going to distribute. The request for proposal is actually out on the street now. And there is a category of funding that's available for that 0 to 5. A lot of the evidence shows that, and you know this from your educational background, right, Counselor, that focusing on those early childhood years are critical for long-term success, especially when we have so many children that experience adverse childhood events that impact learning and ability to succeed. So I do know that we work closely with them on that, and I apologize that I don't have the Project Launch
No, that's okay.
info in front of me.
That's great. And that's it for this round.
Okay.
Thank you.
Thank you.
And Councilor Presley is joined us and has the floor, if she so chooses.
Well, thank you, Mr. Chairman. I'm still going over a couple things. I'm not sure if you can answer this or not. Was very appreciative of Chief Martinez participating and leading my annual Healthy Boston briefing for my colleagues, and really love the new reporting, comprehensive, interactive, love the infographics and all. Is that the appropriate terminology?
Yes.
Great comprehensive report, and confirm some of what I've been seeing anecdotally, and then also sort of elucidated some gains that I was not aware of. But one of the things that was unfortunate, if not even disturbing, is that we had very little Asian data, if any at all. And what the chief had shared is that there hasn't been enough, or maybe actually, you said it, perhaps, that there's not a big enough sample universe, or, and so I just wanted to revisit that, just to think about how we might address that. Because we don't want to feel that an entire segment of the city is not being represented in our data.
And I think one of us probably said that, and I
Yes,
remember that
yes,
question, and
yeah.
I think you're right. I mean, some of it was sample size, and I believe our Director of Evaluation and Research, Dan Dooley, had mentioned that in this next round, that we knew that was a gap in the last report that we had issued. In this next round, I can confirm, but I think he had mentioned that we're actually doing oversampling so that we can generate more Asian-specific data to address the issues around those small sample sizes. So I believe that was an improvement that we were implementing in this next round of the report, and I can confirm that.
Okay. And then also, I don't know if you have it with you, and if you don't, we can share it with my colleagues later. But I asked during that briefing about your ability to, one, get data and research in real time from the state And so we'd at one point been looking at legislation to make sure that you were getting that data more quickly. And so I wonder if you could speak to that, because certainly that informs what investments we make. And then also, could you just speak to what we spoke about in the briefing relative to how many dedicated researchers you have, commiserate and in comparison to cities of a similar population?
So on the question around the state, so we spend a lot of time working with our state colleagues on trying to get more real-time access. In our Infectious Disease Bureau, we're able to use one platform to more rapidly access infection disease-related data in real time. We're working with them now on some of the data challenges around tracking and the way we look at our opioid overdose data. So it has been collaborative. I think, having worked at the state, I have this appreciation for the kind of data cleaning and scrubbing that they do, but I think I can also speak on behalf of all the local health departments that when we're trying to generate community health needs assessments and provide that data when, our elected officials ask for it, having a 10-year data lag is not helpful. And some of the data, I think, 2015, they have been sharing, and it has been improving in terms of sharing some data before.
So is the improvement about technological investments and upgrades? Is it about improved coordination, or just?
It's really about, in terms of getting, doing what they need to do on the state side to ensure that the sample side is set and final before they share it with us. And then on the coordination piece, before we do any publications or reports, really doing a good job of coordinating and communicating with them before we do that, especially if the data sets aren't closed. But we're happy to do another follow-up discussion so we can accurately share how that works, because it is really different depending on the data set.
We just want to make sure that we're being partners with you, because that data is so critical, and if we needed to do any lobbying on our end, or if there was something needed to happen procedurally or legislatively, that would be something that we would look to. And I believe during the briefing you said that, correct me if I'm wrong.
Oh, right.
Do you have 9 dedicated researchers in comparison to a New York for epidemiology that might have as many as 300?
I can't remember now what Dan said. He had the number. I'll have to confirm. That sounds right. I know it's less than 10 or 12, but then New York City is huge.
Bigger, yes.
That's not comparable. I think a comparable city I think I put out there was Seattle, and I believe they have twice as many individuals who specifically are doing research in epidemiology. So, and we're more comparable to a Seattle King County Health Department. That's 9 in Dan Dooley's unit, if 9 is the number. But then we also have epidemiologists in Infectious Disease Bureau. We have epidemiologists in Child, Adolescent, Family Health. And when you take those numbers, we might be a bit higher. But
Okay. And then anything that you could walk us through on the trauma support side?
sure.
In terms of the role that the Health Commission is playing with that, and I know that work is across, agency, and we've been working diligently to improve communication and coordination to make sure that we're supporting families impacted by violence in the city. So what is the role the commission is playing?
So I wanted to thank you. When I first arrived, I know I was in the educating myself mode, and clearly you've been a leader in this work in the city. So I wanted to thank you, because I'm really proud of the initial work that we've been able to do with the Boston Neighborhood Trauma Response Teams. I had the opportunity to actually sit with the teams during the aftermath of the double homicide at Bromley Heath. And got to see the neighborhood trauma teams, not just the ones in JP, but really the other teams come together to provide additional support to that team. They attended community vigils. We were there one evening during a cookout to provide resources, materials, a few days after the shootings. And we also, so I got to see how that worked in terms of the mobile response unit, and then our community-based partners, for example, from Tree of Life. and Bashir and his colleagues there. We also had the unfortunate, I don't know if opportunities, it was actually terrible, but we engaged the neighborhood trauma team after the fatal stabbing outside of 112 Southampton Street last week. And we made the call. I made the call through our staff to the hotline. They were there within an hour, came to the shelter to console and provide support to staff who are clearly traumatized by witnessing something that none of the staff and clients had ever experienced. And so the neighborhood trauma teams were actually there prior to the arrival of our EAP colleagues. They continue to provide ongoing support to clients and staff. So we've worked really hard with the community health centers, the community-based organizations, with community partners, with BCYF, with Chief Martinez, with colleagues at BPD and others to make sure that we're promoting what the services look like and linking clients to the services. I know we've done a lot of work to try to figure out how the response works when that call comes in, because that was, I know, an opportunity for improvement for us, and we have a much larger team that is helping with the response. And I know that they're in the process, they had mentioned, Charlene Luma had mentioned that in the next couple of weeks, they've already begun to figure out ways to engage 20 more additional community responders.
Great. Yes, and the Office of Public Safety has been a great partner in this, and I'll wrap here just that. Encouraged that we have made great strides when it comes to trauma response. I think what we're still trying to figure out is trauma recovery. And that's harder because, obviously trauma manifests itself in many different ways. Some people it's more forward presenting, others it may take weeks or months. And so we're doing a better job at being there in that first sort of critical, 24 to 72 hours. But how do we build the resiliency up in these communities so that that support is there? After the cameras have gone and the papers have stopped writing about it.
And the one, I was looking for it in terms of the data point, because I know that when we redesigned the program, we knew that the community response factor was something that we had to staff up, design. But on the recovery side with the community health centers, between March of 2017 and August 31st of 2017, they were able to enroll 249 new clients just in that period of time. These were new clients that had not been seen at those community health centers. So that is a great testament, I think, to the bridging work that this new model has been able to facilitate between the community-based responders and then the behavioral support services. If I could, on the neighborhood trauma teams, what we were able to learn, and I don't think this is news to the council members, that 74% of those new clients that we engaged reported being or experiencing chronic exposure to violence. And that, considering that these were new clients into care, is important for us to address and to hopefully provide recovery services to help break the cycle of violence that they're experiencing.
Thank you. Thank you very much.
Thank you. We've since been joined by Councilor Kim Janey, and Chair recognizes Councilor Matt O'Malley.
Thank you, Mr. Chairman. Good afternoon again, ladies. Apologize for being late. I'll catch up elsewhere, but have you, in terms of the infectious disease, and I apologize if you've gone over it already, but can you talk a little bit about certain trends that maybe we've seen in this calendar year?
Sure. Trying to see here. I can tell you some of the trends and challenges that we identified in our Health of Boston report, which I think you all received copies of. And they really lift up what we at the Health Department through the report have been focused on, which is around health inequities. So between 2013 and 2015, Black and Latino residents experienced higher rates of newly diagnosed rates of HIV infection compared to white residents. We also saw in a report that we're actually going to be issuing shortly around cancer, that Asian residents experience higher rates of hepatitis B, as well as liver cancer incidents compared to their white residents. Those are some of the key. And then we're also, I think I talked about needing to continue to work on the chlamydia rates
The goal
and
was-
disparities that we see.
And the goal is to decrease it by 25% this
Right,
year?
between the racial ethnic groups, the disparities.
And what were we able to, was that the
That's
outcome?
the goal in FY19. So
Okay.
increased education outreach,
Good.
testing.
And there were a number of tuberculosis cases in Boston this year?
There, we have 42, I think, is the figure, active
Yeah.
cases, and then we also have latent cases of TB, but 42, compared to other cities, is relatively
low,
small.
yeah.
Quite low.
Yeah, and is that a decrease from prior years in
I'd
Boston?
have
or-
to double check on how that compares to the previous year. I don't think that we have that information in front of me.
Okay, and that's helpful. So I came in, you were talking a little bit about what had happened at Mildred Haley 2 weeks ago, and was there with my staff as well, and wanted to publicly thank you and commend your folks for being there, the trauma response team. It was heartbreaking, and it's one of the reasons why Councilor Janey and I have called for a hearing on violence in the summertime, because obviously as the thermometer rises, so too do these horrific incidents. So do you feel that you have enough staff in terms of the, I assume the answer is yes, so maybe I should phrase it another way, but what additional supports can the council offer you guys, particularly as it relates to the trauma response team?
That's a good question. I mean, right now, we were pleased in the mayor's budget that we got an additional investment that will allow us to expand the teams. So we had the 5 teams, 1 in Dorchester, so we'll be able to increase to an additional team. We will also be able to do a stronger evaluation and data collection with these new funds and this learning community. A lot of the, there's a heavy component around training and education for the trauma response teams, and they really appreciate being trained on trauma-informed care. I think in terms of capacity, I mean, we've been able to do more through the SMART team. We would love to be able to increase capacity in terms of the materials that we develop. Right now, it's available in English and Spanish, and we've had requests for translating and developing. We have some draft materials that I think are being developed actually in Cape Verdean Creole.
So having that cultural competency.
So that
to make
cultural
sure, yeah,
competency.
it's important.
Yes, and obviously, you know, we wish the teams didn't have to exist, right? But we think that this is, the additional team will make a big difference
Yeah.
in the way that it's structured.
I agree. I know you talked a little bit about in some of the community initiatives, the tobacco control. Are you still working with BHA on smoking cessation products for residents?
We are.
And how does that work? Is it nicotine gum? Is it the patch? Is it
So
lozenges?
it's a combination of
Yeah.
tobacco cessation. So I don't have it. I believe the way that they provide, it's comprehensive. So it's a combination of, you know, the medication, gums, a gum. So it is a number of different things. And then I think counseling is also part of that when they're providing tobacco cessation support services.
How many people took advantage of that last year?
I can find out how many. And is the question specific to our BHA residents? Or generally?
I guess both, general. I think this is one of the programs that we do not tout enough. Obviously, rates of smokers have dropped, you know, from where they were 30 years ago or even 15 years ago. But it is increasingly more expensive to quit smoking. So any support that we can do, and I think this is something that you and your team do exceptionally well. Every time I go to a BHA, you know, coffee hour or pizza party, I remind residents that there are opportunities and resources out there. So I'd be interested to see how many people have taken advantage and what the follow-up has been. Because I think the program is terrific, and it's sort of, the counseling piece is key. I wish we didn't include the Chantix or whatever the drugs are, because I don't think that's necessarily a good way to quit smoking, certainly the gum. Some other things may be a better way to do it, so I'm just glad you do that. And then, my time?
Pretty much.
Okay, I'll wait for the next round. I was late, so I don't want to say so. Yes, Monica,
I
if you
can
wouldn't mind.
confirm that. I
That'd
want to
be
make
great.
sure that I confirm that the
Good.
Shantix is part of that, and I might be confusing it with my state health department days, but I will confirm that.
Okay.
And we have, I think we're really proud
You should be.
of
That's
the
great.
strides that we've made, in terms of progress. We've seen a decrease in youth cigarette smoking, a decrease in the percentage of adults, as you've mentioned, the BHA, exposed to secondhand smoke. And I know some of this is because of a lot of it is because of the regulations and the support of the council.
Sure.
Thanks.
Thank you. Thank you, Mr. Chairman.
Thank you. Councilor Janey.
Thank you, Mr. Chair, and thank you. And I think I will continue just on these questions around smoking. So great to see the decrease with youth cigarette smoking. I'm wondering if that also includes things like the e-cigarettes and, what is it, vaping or something that people are doing? Is it called vaping?
It is.
Yes.
Juuling, vaping.
Yes, and so does that figure then include that? Because I'm always amazed at the number of young people who I see smoking cigarettes. I know way back when I was young, cigarette smoking was considered cool, but I think now there's been just a lot more information and education about the dangers of cigarette smoke and how bad it is for your health. But I worry that these alternatives have now kind of stepped in and are taking the place of that. And I think there are still questions as to whether those items actually harm folks, which I would argue that they do, but I don't know what the data is, so I'm asking you.
And we agree. In terms of the e-cigarette being harmful among our young people, I think one of the things and I'm sorry, I don't have the specific data point in front of me, but I believe in the Health of Boston or the most recent YRBS, we did have data. Again, there's a delay, a lag in terms of what we see that showed that there was a decrease in terms of youth using e-cigarettes. However, that was from 2015. There's been a lot in the news, and we've been hearing anecdotally from several of our schools in Boston that they've observed students vaping or juuling. So this is actually something that I had asked our research staff to help us understand more. So I can share with you more up-to-date information about e-cigarettes following the hearing.
That would be helpful. I'm also seeing an increase in the number of smoke shops that are in different commercial areas or neighborhoods. And I'm not sure, whether or not they're really being monitored and watched in terms of whether young people can access their products at these places. But I worry that this is kind of the new trend. And because there's still not a lot of information out there that, young people are just opting, or anyone is just opting for the e-cigarette or the vaping.
So we, in 2015, passed a law through our Board of Health, Tobacco 21, and it also included flavoreds. And the state I think it's poised, the governor's poised to pass a state law around access under 21 to tobacco. But through our Community Initiatives Bureau, we actually do have environmental health inspectors that do enforce the regulations that we have around access of sales of tobacco to minors. Sometimes we use minors to try to purchase tobacco, so there's an enforcement activity that we do through the health department. So if you have particular shops that you're concerned about, certainly happy to follow up with you as well.
That's great. Last thing on the trauma piece. I would think that we certainly need more. I'm not sure if you think that the staffing is adequate, but would hope that we could have additional staff. I worry about whether or not there's a system in place that really looks at the trauma that families and young people experience when they are not directly connected to a victim of a violent, shooting or crime. So, for example, and I think I raised this when I met with you, let's say there is a shooting on a particular residential street. Let's say a family member is injured of a particular household. That particular household, would get the follow-up and support through your office, through the trauma teams, the police, hopefully. But the other residents on that street are also traumatized by this event. And let's say there are 20 school-aged children who live on this street, and that those 20 school-aged children are going to dozens of schools the next day. There's no way, I don't see how, whether or not those schools are then equipped to even know that this has happened to that their, student has experienced this, not directly, but indirectly. And so I'm just wondering what we can put in place. So for that immediate child in that household, I think there are some supports, but for the additional children and families who are also impacted by that situation, if there's a way to kind of close those holes, because the entire community, the entire street is impacted when these incidents happen, not just the immediate family. And so I'm just wondering how we can get the information out to the schools that, we know that in this area, this happened, and that these children are affected and they're attending these schools. Is there something in place now that then those schools are notified that students who come to this school lived in this area and may have witnessed, may have experienced this, and that the teachers and the school staff are then prepared to address this issue and work with those young people?
So I remember we talked about this when we met.
And I know
it's a great question that you raised, because the one thing that I would just underscore is that the neighborhood trauma teams, they actually do a lot of work with the community kind of at large. So if you didn't necessarily have to be there to witness the violence, but as you said,
Exactly.
if you're hearing gunshots fired in your neighborhood, that is traumatic, even though you might not have looked out the window and seen someone hurt or shot. Anyone can call our hotline for the neighborhood trauma response teams. And I actually think the way that I would answer your question is that this presents an opportunity for us to work even harder with BPS so that they're aware of the resources that we have. We did work in partnership with Assistant Superintendent Nieves and Jill Clark when we were conceptualizing. They had a staffer involved with us when we were brainstorming and redesigning the new process, but certainly I think we can work harder. And the issues or the concerns that you raised did come up in a recent sit-down that I had with our young people who are part of our Peer Leadership Institute and our Youth Advisory Board. They talked about, and these are young people, high school students, who go to school in the city, the exam schools, charter schools. There were a couple young people who were going to schools outside the city through Metco. All of them. This meeting happened, I think, maybe 2 or 3 weeks before the summer safety meeting that Commissioner Evans convened. All of them relayed stress, like individual stress that they're experiencing, even though some of them agreed and shared that they hadn't been a victim per se, but had they were hyper aware of their surroundings and really felt like school is supposed to be a safe space, and after the Parkland shootings, they didn't feel like it was a safe space. And then once school is out, and the summer's out, they were concerned that the violence was going to ramp up, just like Councilor O'Malley had relayed. So I think that we can do a better job. We can work more closely. We have been sharing information about the neighborhood trauma teams, but happy to think through with you and maybe the superintendent about how to expand awareness of the different services that are available, not only at the commission, but through BCYF, and other departments.
Yeah, and I can appreciate that, and I know that not everyone who hears gunshots is going to follow up and call a hotline, and so I guess my question really is, how do we ensure that these receiving schools know the very next day that, you know, students have experienced this or may have experienced this? And if there's a way to kind of just close that gap, certainly I think getting more awareness and making sure that folks understand what resources are available is helpful, but, you know, my sense is a lot of folks, I mean, I've heard gunshots from my home, and I've never called a trauma hotline, though it is very traumatizing and traumatic. But I'm particularly concerned about our young people who have to go to school the next day having experienced this, and school communities not being aware, because our children go to so many different schools from that any given street, that they may be experiencing things throughout the classroom that school staff may not be ready to kind of understand what's happening if they're not clear that something has happened. So I wouldn't want any behavior for a young person to be looked at as acting out without really understanding the root cause. And I know the school department has done a lot in their Cell Well program to really kind of unpack issues of trauma and understanding that acting out is a symptom of something deeper and not necessarily something that we should try to penalize. But I'm just hoping that there's more collaboration and opportunity to make sure that when young people do experience trauma, that our schools are ready to respond.
And I'm happy to follow up with the team there to better understand their system for having situational awareness of the different incidents that are happening in the community because of the issues that you raised.
Thank you.
Thank you. Councilor Flynn.
Thank you, Council Siomo. I know in one of your slides, you highlighted, you know, frequent marijuana use makes it hard to learn, pay attention, and memory issues. Are we tracking students in the public schools that are using marijuana? And if they are using marijuana, how can we get them, you know, medical care or any type of assistance, knowing that they're going to eventually have some of these memory loss issues or health-related issues?
So I actually don't, I'd have to defer to the schools about how they reach out to their students that they know might be using marijuana or other substances. But that's not information that we would have at the Health Commission. But, you know, I think the campaign that we would be working on we'll be hopefully trying to get the message out that you just said, which is long-term use of marijuana affects brain development. That the evidence is clear on that. But how the schools deal with that challenger issue specifically with the students, I'd have to defer to the superintendent.
And I know you mentioned an increase of marijuana use with Latino youth or people in the Latino community. Is there any type of outreach we're specifically doing for them to help them learn about the dangers of marijuana?
I think that would be part of how we would look at the prevention campaign and ensuring that we're tailoring it to serve as many different populations that we need to reach.
Okay. I had the opportunity recently to visit the South Boston Health Center.
Yes.
And the South End Health Center. I know they have some great programs there, as does South Cove. I know the Asian community has a 2 times higher rate of diabetes, and there's a lot of substance abuse issues in South Boston, other issues in the South End. But are we doing enough for our community health centers across the city? Are we giving them the right amount of funding? If we're not, is there any way we can consider what additional services or funding that they need?
Good question, and we work really closely with our community health centers across our different programs at the commission. I can talk to you about funding in a couple of different ways. So they receive direct funding through the Health Commission, and we can give you that amount if you want. I can see Grace is thumbing through her binder to get that. And then so some of the health centers receive grants directly. There are also grants that we issue or distribute through a request for proposal process, where community health centers like the neighborhood trauma teams, they were, in order to be eligible to apply, they had to be the lead organization. There are also funds and initiatives that we get to the community health centers because we receive a grant, for example, from the state. So one example of that was with our funding that we received from the state around Prevention Wellness Trust Fund resources. We partnered with several community health centers to help us work on falls prevention, hypertension, and pediatric asthma. So they receive, some of them receive a direct grant, some receive grants because they apply for those grants, and then some are partners with us on both state and federal and, other types of grants. I don't know if we have the specific, if we can provide it to you offline if you'd like, in terms of the
that'd be great.
specific CHC grants.
Sure, they were in visiting us several weeks ago and gave us a presentation on some of the great services they're providing throughout the neighborhoods of Boston, and they're just doing an excellent job, and we're proud of them.
And we do a lot of work actually with Bill Halpin in South Boston, and then, with Bill, the other Bill Walczak
yeah.
in the South End, so.
The community health center grants have been level from 18 to 19, and that's $634,532. So
Okay.
$3.6 million to the CHCs.
Okay. I wanted to follow up on something Councilor Janey was focusing on, trauma and people experiencing trauma or people observing trauma or violence as well. I served 25 years in the military, and I know a lot of people in the military do experience trauma or violence, and they have to almost stay in ongoing counseling for the longest period of time. But, these young people that are also experiencing violence or trauma, they're probably also experiencing PTSD-related symptoms, and it's a long-term recovery for many people. Are you focused on that it's that severe of an issue, and that treatment is not short-term, but it has to be a long-term solution?
Yes, and that's through the key services that we offer to deal with that ongoing trauma recovery work is through the neighborhood trauma teams, and those go out to the 5 health centers. So JP, Mattapan, East Boston, Roxbury, and Dorchester. And in FY19, we'll plan on issuing another grant for Dorchester Health Center and community-based organization. But those, you're right, I think that's the important part of those 296, new patients that we were able to connect with behavioral health services in a primary care setting, the health centers.
Okay. Then my final question is, just being a longtime Boston resident, I've seen the tremendous work of our EMS staff responding to so many difficult situations across the city, being there for our residents, many difficult environments. Are we doing enough to make sure that they have the services that they need? Are they paid enough? Do they have the right training? But they're exceptional and they're dedicated, and we want to make sure that we can provide them with any tools we can.
I think we're going to have the EMS portion of this Monday.
Okay.
So we'll have, Jim will be here to testify and talk about all EMS issues.
Okay.
Okay, thanks.
All right. Thank you.
And you good? Okay, thanks. Councilor Sabi George.
Thank you, Chair. Again, so I have some questions about the Mayor's Health Line and just want to understand the impact that that has had on accessing some of the resources that our residents would use.
Let me find, did you have?
It's through the Community Initiatives Bureau.
Right, it's through
Just
the.
can you talk to me a little bit about
So
what
let me
that
tell you-
helpline is?
Sure. So the Healthline has several staff. They're multilingual. It's a free service that we offer. You can call. Many of the calls that we get, particularly of late, are around the impacts of the state's changes to the health insurance plans because of the Accountable Care Organization. So they help individuals if they are trying to figure out how to access different benefits that they might have, understand, the benefits that they have. If they need to enroll or re-enroll, they help guide the individuals who call. Several of the staff are also, they're also certified patient navigators. So they have done this in terms of enrolling individuals onto different mass health programs. Trying to think. As I said, they're multilingual. They also have, just so you know, there's an app that they have created called Healthy, I think it's Health Steps, with Children's Hospital. We can get you a copy of that app. So if you called and you had,
And would you call a particular phone
Health
number?
Lab.
Would you go through 311?
you can go to 311, but they also have their individual phone number. And you can call them and they can walk you through how to, if you have a smartphone, how to download this app. You can also download it on your computer. We actually worked with Children's Hospital to create this app so that if I called and I needed, I'm a single mom, and I came back from my primary care visit and need to find a place that accepts my insurance so that I can exercise, but I also need daycare that's close to it. This app, literally, you can put in different parameters and it will generate different options for you. So they're using technology to help individuals navigate both clinical and community-based resources to be well.
And so the line item, which is under the Community Initiatives Bureau, is that mostly covering staff?
Yes.
And how many people are on staff through that department?
4.6 FTEs on city funding. And
And then the
then,
rest is through some grants?
Yes.
Say Navigate a grant and,
they have some small grants. One of their grants has ended. But we are always aggressively pursuing external funding. We have a pre-award grants department who's focused on that.
great.
And then our bureau directors are always on the lookout as well for partnerships.
And then how many people have used that line? When's it been in existence since?
Gosh, it's been in existence. I don't have that in front of me, but it was in existence when I started in
Oh, so
2001.
it's been a number of years old.
Yes,
Okay.
Mayor's Healthline
Okay.
has been in.
And so how many individuals did we assist through that hotline or health line?
I would have to.
Last
I can find out. I can actually find out because I ask them this question often. How the total and then the types of calls that they get in terms of frequent questions. We can get that for you.
That's great. And I would wonder if there's any, especially because it's accessible through 311, if there were any questions that were significantly asked over and over that are easy to answer, that 311
Good idea.
could become a little bit more interactive. I'd also like to see, and this is, I think, more related to our earlier hearing today, but it just dawned on me now, is I'd love to see our needle disposal kiosks listed on 311 somehow. Somehow that's just easier. We get a lot of calls in our office about where we could where individuals could dispose of needles.
Okay.
But I've just totally digressed. Councilor Flynn was asking a lot about asthma and the reduction of asthma in the city, which is great. But when I went back and looked at some of the dollar amounts that we're spending on asthma prevention in healthy homes, it seems like there's a total reduction in specific funding towards asthma prevention. I'm sorry to jump to a whole new topic so quickly.
Are you looking at the internal funding, Counselor? So for FY19, the 651,000?
No, I am looking in, so I'm not actually in the budget book. I think it's a photocopy of the budget book. It is the, yeah, external funds. Oh, you know what, the external funds was under my paperclip, so maybe that's what so is that all grants that have gone
Yes.
away?
Yes.
Okay, I should have flattened my sheet further, and I see now external funds. So have we just, there are no more grants available? We're not applying for grants in asthma reduction, or?
We're always applying for grants. Sometimes the grants have come to an end. There has been a delay in the federal funding being released. We actually just saw a couple weeks ago some new funding from CDC being released. So part of this was the never-ending continuing resolutions. Now that they actually have a permanent budget for the rest of this federal fiscal year, we're actually seeing the money come out. So we are actively pursuing that.
All right, so now that I look at the rest of this page with a slightly different perspective, would that be the case too in some of the reductions with biological safety? It looks like we've seen a significant reduction in public health preparedness. The Community Initiatives Bureau, so this would just be for external funds, though.
Right, the public health preparedness funding has been decreased. That is a pass-through from the state, the CDC, and the Assistant Secretary for Preparedness and Response. That funding has decreased. And under community initiatives, the Prevention and Wellness Trust Fund is set to expire this year. And that supported not only the commission, but also a lot of the community health centers as well.
And is that the same with the community prevention services? The substance use prevention?
Post-overdose follow-up?
Oh, no, I'm sorry. Yes,
That's different.
post-overdose follow-up, yep.
The post-overdose, that was actually an increase in but you're looking at the file.
So I'm looking at the external funds, though. So these are the grants.
I'm not sure what that is. Oh, that, I think, was a one-year, maybe that's why it was. That was something, it was a pilot that Jen talked about earlier today.
Okay.
Which was a pilot award that they received to provide post-overdose home visiting. That was with BPD and fire.
And then specific to the mayor's health line, it looks like we're maybe, we don't have a repeat of the a $200,000 grant that was FY 18's budget, now zero.
The health resource,
Yep.
right, that grant has ended at this point.
So we
Now, I will tell
compensating
you,
for that on?
yes, I can
some
tell you
level?
right now that they actually did apply for a grant I'm aware of through Mass Health. So as Grace said, our staff with our pre-award development director, they aggressively pursue funding to help sustain programs that actually have been effective. So I know the Mayor's Health Line had submitted a grant recently, so we should be finding out about that.
Right. Excellent. And it looks like the same is happening with some of the trauma prevention, that there are a number of grants that have gone away. Choice Neighborhood, Defending Childhood, Determination of
Yes.
Need.
Yes, so DCI was, I believe it was a 3-year Department of Justice grant. And so some of those are, as Grace said, the sort of the ending of a grant cycle. And they've been working to look at additional resources with the Grants and Development team.
And a lot of those grants fund positions. So
Yes.
are we, because again, I'm looking at this external funds as opposed to where there might be some new revenue opportunities. We're not seeing them here. So is this being replaced elsewhere?
So if those, when funds end, and I can speak to DCI, for example, I believe there are 3 FTEs that are funded under the DCI program. The staff knew that the grant was ending. I believe at least one has already resigned because they were looking at other
Yeah.
opportunities. And so what we do is we do encourage people to interview when there are vacancies at the commission, to try to interview for other positions for
Yeah.
which they're qualified and where there might be a good skill set match. But we're still trying to find funding to continue some of the core elements of the DCI program because it has been highly successful. grant that we've done in terms of trauma prevention and trauma-informed care.
Yeah, but unfortunately, though, when the grant goes away, the funding for the position goes away, the work often goes away, too.
That is the case, yes, unless we find replacement funds.
Okay. All right, very good. Thank you. Thank you, Chair.
Thank you. Councilor Presley. Good. You know, it probably should have been asked this morning, but I was wondering what the trends are with ODs, overdoses, and Narcan applications, and you know, just recently saw the state of Massachusetts saw a slight decline in particularly opioid overdoses, and I don't think it was asked this morning. Okay. And if you don't have it, I apologize for not asking it at the appropriate hearing, but I thought it you know, like to see those numbers.
So I think I did share this, but I'll share it again because
Appreciate it.
The overdose numbers, you are correct. In the last, I think the state will be issuing their next Chapter 55 quarterly report. I don't think we've seen it yet. But in the last report, they reported that there was a 12% decline statewide in terms of non-fatal overdoses, and that is probably consistent with what we see in terms of people being with the overdose reversals with Narcan. We see that the overdose reversal numbers are also climbing in Boston. So in 2017, we trained more than 23,000 people around Narcan. In 2017, EMS, and Chief will probably go into this more on Monday.
Yeah, right.
They responded to 3,624 narcotic-related illness cases, which was an increase compared to 2016 when they responded to 2,879.
Wow.
I did have.
That's significant.
Let me just see if I have it handy.
Difference.
There was, because of what we're seeing, we actually did hold a gathering, a convening in February of this year, specifically with healthcare. So we had hospitals, some health centers. We had Judge Coffey joined us. It was a multi-stakeholder group. It was co-sponsored by Michael Botticelli at the Graken Center, Barry Bach from Healthcare for the Homeless, Jen Tracy, and the Public Health Commission. It was a small group, but we zeroed in specifically on what we have been seeing in Boston, which is an increasing trend in terms of overdoses, and we've only focused on overdoses. So some of the key themes that came out of that gathering was that there needs to be a better system of coordinating all the services across our different sectors and our different resources, because there's a lot of energy and investment of resources being made around the opioid epidemic. So Chief Martinez, I don't know if he's still here, and Jen will be leading the convening of a cross-sectoral task force specifically looking at opioid overdoses. And then there are 3 action teams that are being stood up. The Public Health Commission will be leading the action team that's going to be focused on how do we use data in more real-time ways to address what happens after a non-fatal overdose, and are there opportunities to intervene, right, and prevent another overdose for that patient. Michael Botticelli and the Graken Center will be leading the efforts around hospital-based opioid treatment and how to ensure that all of our hospitals in Boston are working together in a systematic way around providing treatment in ED and different hospital settings. And then the third action team will be led by Barry Bach and Dr. Gaeta at Healthcare for the Homeless, and they'll be focused on an issue that came up in terms of frontline staff and self-care and workforce development. So for those staff who many times all of us in public health and at Healthcare for the Homeless and our homeless shelters, we often we hire people with lived experience to be recovery coaches and navigators, and the work takes its toll on the staff. And so how do we do a better job to promote and create opportunities for self-care? So those are the things, the steps that we're taking as a city in partnership with those other organizations specific to overdose.
Right, great. And the overdose problem isn't going away. In fact, it's probably getting worse with the fentanyl, strength of fentanyl being added to opioids as well. I was just wondering, as far as overdose deaths, have they gone up, down, stayed the same?
You know, it depends on the point in time that we measure it. Chief and I just met at the beginning of this week to look at the fatal overdoses because, and you'll hear more from Chief, so he can get into it.
Yeah.
But
Breaking
we
my
can,
own
through
rule.
the NRI system, look at week to week and then aggregate throughout the year. And when you look at the year, it's probably comparable, on track, but at any given time, the numbers could spike in terms of
Right.
what we're seeing in terms of transports.
Right, and that could be associated with a shipment of bad dope.
Right, and fentanyl seems to be in a lot of the drugs that,
Yeah,
that
right.
they're responding to. So for example, last September, we issued a health advisory because we did see an alarming trend in the month of September that was significantly different than the year prior and prior months at that time, and then worked with the community to push out the messages through our medical intelligence center to providers, people who treat and care for patients with substance use disorders. And then we also worked with our communications team and the mayor's office to push out an alert and an advisory to let people know that they shouldn't use alone, that they should have someone who has Narcan, and obviously encourage people who are ready to seek treatment and care to get engaged with care. So when there are instances where we do see a spike or something that is different than what we've seen in the past in terms of trends, we work across the team.
Great, thank you for that. And just lastly, lead poisoning. What are the trends are you experiencing with lead poisoning these past few years, let's say?
Lead poisoning. Let me, we have actually, in terms of the short list of progress in the health of Boston, we did share that we've been seeing a continued decrease in elevated lead levels among kids under 6.
Great. I know we've had a program with DND for 30 years now, and it seems to hopefully be having an impact in the housing stock and the effects of it on children. So that's good news. And the
Grace-
asthma trend is good news as well.
It's good news. And
Yeah.
Grace had just shared some more specifics in case you're interested. Our environmental health inspectors that I mentioned, they were able to, they did 64 home inspections for lead paint hazards in homes of children who were referred to us because they had elevated blood lead levels. They did 203 educational home visits, and they were able to link 73 children to be seen at pediatric lead clinics. They were able to go to 32 community outreach events and distributed thousands of different educational materials to make sure that people knew how to link to care.
Great. Well, Monica, oh, sorry.
I'm so
Yeah,
sorry,
sure.
Mr. Rosette. Well, I just wanted, could you just reconfirm that the health line is multilingual and what languages we provide?
So the Healthline is multilingual, so we have multilingual staff, so it's not like a,
I
service
see.
where you have to call, we actually have staff who speak different languages.
Okay.
So English.
cover the range,
We
Haitian
cover the range,
Creole,
Haitian,
Mandarin.
yes, and I can get that list to you, so.
So long as
So
it's
you have it.
happening, that's the main
Yes.
thing. Okay, all right, thank you very much.
Yeah.
Great, thank you, and thank you again for a long day, and thank you for the incredible prevention work you do that makes our city such a great livable city as well, and to you, Grace, your team, and all the folks in the field, I thank you, and this hearing is adjourned.
Thank you.